Thank you to SUFU for inviting me here to speak today. My name is Alexandra Melnyk, and I'll be presenting Home Urinary Tract Infection Testing, Patient Experience and Satisfaction with Polymerase Chain Reaction Kit. We have no disclosures. Approximately 60% of female patients experience at least one urinary tract infection in their lifetime. 20 to 40% of those patients have one or more recurrent episodes of UTI. The most common pathogens include E. coli, Proteus mirabilis, Klebsiella pneumonia, and Enterobacter species. The gold standard for diagnosis is a urine culture with speciation and sensitivities. Recent guidelines for women with recurrent UTI recommend a urine culture with sensitivities prior to treatment of every episode of UTI. Advanced technology offers molecular diagnostic techniques such as polymerase chain reaction or PCR testing instead of the standard urine culture. The largest study to investigate a novel multiplex PCR-based UTI analysis that identifies and quantifies both pathogens as well as sensitivities to various antibiotics was recently demonstrated to be non-inferior to traditional urine culture. During the COVID-19 pandemic, patients in our practice were offered this multiplex PCR test for home collection when UTI symptoms developed. Thus, our objective was to assess patient experience and satisfaction with the multiplex home UTI PCR test. Secondarily, we sought to investigate the types and resistance patterns of isolated uropathogens. We hypothesized that patients would be satisfied with this option for UTI evaluation. This was a cross-sectional study at a large academic medical center of women with symptomatic UTI from April 1st through July 15th, 2020. Patients were included if they reported UTI symptoms via telemedicine visits or by phone calls. They also had to agree to utilize the multiplex PCR UTI home kit. Patients were excluded if they desired to submit the standard urine culture at a laboratory. Kits were sent to patients via FedEx, and patients followed instructions to collect a clean catch specimen at home. Samples were then returned to the laboratory via FedEx. Patients could anticipate a result in 3 to 7 days from when they initially called the office. Once in the lab, DNA was extracted from urine and analyzed with PCR utilizing probes and polymers for 24 separate bacteria in 2 bacterial groups. The multiplex PCR UTI test reports a pooled sensitivity of 19 different antibiotics. After their tests resulted and they received treatment, a 5-point Likert scale was utilized to assess patient satisfaction along with a few other questions via a brief telephone survey. Finally, we reviewed the medical records. Our primary outcome was patient satisfaction with the experience. Our secondary outcome was the type and number of uropathogens on testing. A total of 30 patients, mean age 71.9, with UTI symptoms had a multiplex PCR UTI test completed. 73% of the patients were Caucasian. 47% had a history of recurrent UTI. Patients often reported multiple symptoms, with the most common being dysuria at 53%. Regarding patient satisfaction, collective responses on the 5-point Likert satisfaction scale had a mean score of 4.7. Patients responded most favorably to convenience of the test, mean 4.9. Patients responded least favorably to the accuracy of the test, mean 4.5. Overall, 86% reported that they would choose this test again. And of 21 patients asked if they would choose this test again outside of a pandemic, 86% responded affirmatively. The PCR identified at least one bacteria with colony counts greater than 10 to the 5th in 97% of patients. The 3 most common pathogens identified included E. coli, Enterococcus faecalis, and Enterococcus urinae, which is consistent with the literature. All but 3 patients had more than one pathogen identified. On average, uropathogens were resistant to 54% of the 19 tested antibiotics. One of the strengths of this study is its novelty. Additionally, this new technology was implemented during the COVID-19 pandemic. This technology allows for access to testing prior to treatment while maintaining a safe environment. We acknowledge the limitation that our conclusions include recall bias. Additionally, we focus on patient satisfaction with this experience, and more research is needed to further evaluate the sensitivity and specificity of this test compared to standard of care urine cultures. In conclusion, a small cohort of women undergoing evaluation for symptomatic UTI who utilized a multiplex PCR UTI home test were satisfied with the experience. The majority of these patients would use this test again to evaluate for UTI, even outside of a pandemic. Given the early positive feedback about this experience, further evaluation regarding patient outcomes with this test compared to traditional urine culture is needed given the novelty of the technology. Thank you.